I'm going to do a little reinforcing with some overlap. Slightly spaced. Yeah, maybe.
I took the liberty of starting using your slides.
Perfect.
Let's figure out where.
All right, should we get rolling with the last thing before lunch? All right, we're going to get started with the last thing, and then we'll get into lunch and some creative work with slide design. I am an avowed keynote user, as Rob said. I haven't worked in PowerPoint, and it's like working in oils versus, charcoal, things like that. Like I work in keynote and haven't worked in PowerPoint in a long time. So when we go through some of the things, I'm going to demonstrate the keynote way. Nearly everything I'm going to show you, there is a way to do it in PowerPoint. I am just not going to be the person that's going to be able to immediately find that PowerPoint answer for you. So I rate myself as a keynote level 9 out of 10. And I think we had a couple of PowerPoint 5s they got, so between the 5, we got a PowerPoint 7 or 8. So we'll have some PowerPoint people to help as well for those of you who want to try to work in PowerPoint during the second session, or the lunch session. So my name is Jason Wagner. I'm the program director at Washington St. Louis. I think I, like Rob, saw enough bad presentations, including some of my own, that I just kind of got fed up with it. So one of the things that I created a few years ago now was an education month where our 30-year residents go through an entire month with me where they learn didactic education in SAEM and then they work with one of our other faculty on both our teaching. And so we use that combination to really reinforce, I think, good techniques for lecturing as well as good slide design. So in an effort to see fewer bad talks, I'm going to watch way more bad talks. Because I have to watch my residents give their talks 4 or 5 times if they develop their talks. So I'm going to go through how the sausage is made a little bit while we're doing this. I'm going to break some of the rules that I've talked about because I actually want to use my computer to demonstrate some things for you. So I'll be going in and out of my laptop, and the venue here just isn't set up where I can do that and still kind of be looking at you guys. So first thing, Apple products now do this automatically, but older versions of the OS and Windows products don't necessarily do this. So a couple things to think about when you're setting up your presentation. And the first thing, of course, the screen doesn't actually project that high. So right here, there's a little icon that I can see on my computer, but you can't. Maybe here. So you can turn that over somewhere. Never be afraid to touch the AV equipment. Yeah, there's the whole scan. So I won't be able to exactly demonstrate this, but there's a little screen icon here. And when you click it, it gives you all your screen options. So when you're setting up, invariably you do a lecture with someone saying, like, I can't see my presenter notes, I can't see my presenter notes. It's because they have it set up to mirror the screen. So everything I see on my laptop, you see on your projector. So if you want to see your presenter notes, you have to turn off mirroring and use as a separate display. And then once you do that, then you'll get a separate display, and then you'll be able to see slides that the audience can't see. You'll get your presenter notes and things like that. So for what I'm doing, I'm going to leave mirroring turned on because I'm going to be using the slides and I want you to be able to see them. Another option up here is there's audio. So when you look at the audio, you have a couple of different options here. You have internal speakers, and you have the decimator, which I assume is their HDMI system. So when you're in a lecture and someone plays a video and the audio doesn't work, it's because they have it put on their internal speaker still, and the audio is playing through HDMI. So for this, you have to turn it to HDMI, or if you're plugging in directly with an audio cable, you would have it on your headphone jack to show up. So 2 little audio video tips to look at before you do your presentation. And then the other rule I broke is that you should demo all this before you talk, and I'll be 100% honest and tell you that I did not do that. Another nice feature with the Apple products, and I don't know if Windows has the same thing, but if you go in the upper right-hand corner, again, you can't quite see it, but there's this section with 3 lines. If I click that, it pulls up my notifications. But if I pull down on that, it has a thing called Do Not Disturb. So you can turn that on. It'll be defaulted on whenever you hook up to an external display device on the newer OS, but not on the old OSs. So if you don't want your email to show up, or you don't want your text messages to show up while you're presenting, especially if you're sharing your screen like this, then you want to put that Do Not Disturb to on. So those are kind of 3 setup tips before you start your presentation. All right, and I don't make money from anybody for anything other than the little bit of money I make from watching you as a program director. So we'll just go through a little of what we all suffer through here.
Quadruple checking notices while in, getting the computer ready, and asking everyone to take a seat. I need to click something on the computer. I love the fact that I don't know what to do with myself. Arriving just in time.
Wrapping up our conversation about popular TV shows watched last night.
Disdain for popular TV show.
Mediocre icebreaker joke. That doesn't quite land. Attempt to redeem myself by making fun of that guy.
Laughing at that guy.
Laughing because he's laughing, I like him.
Not laughing, and now checking out for the rest of the session. Title, dramatic pause of my presentation. Question about how long this session will last? A knowing vague response. Exaggerated eye unknown philosopher to kick off presentation in dramatic fashion. Juvenile flying actors to spice things up. Reading a long paragraph exactly as it appears on the PowerPoint slide about a shocking statistic I just learned about, followed by all kinds of vague lingo that no one will remember 2 seconds from now, capped off by 3 bullet points. Proudly pause to make sure everyone notices my awesome clip art choice. Out-of-date pop culture reference.
Correction about pop culture reference.
Defending pop culture reference by citing social networking sites no one uses.
Audible side, make sure everyone knows this is a complete waste of my time.
Serious and somewhat over-the-top reminder about how important this information is. Unexpected technical difficulty.
All right, so we've all been there, we've all seen this lecture, and a lot of what we're trying to do today is help you avoid that. So before we go into kind of the concept of lecturing and slide design, I want to just play a quick little game. I want you to make as many words as you can make in 30 seconds from this set of letters. So we will start the clock now. All right, that's 30 seconds. So who got 10 words? Nobody got 10 words. All right. We'll just start off with 9. You got 9 words right there, okay. So can you read us the 9 words? Let's look. Okay, so anger, hero, roar. Okay. I don't see roar. Okay, interesting question. All right. Okay, so who's played the game Boggle before? Is anybody there? A few Boggle players out there? So the game Boggle confines you with a set of rules. 2 of the rules are letters or words have to be more than 2 letters. One of the other rules is that words have to be contiguous, and you can't go back and forth to use letters multiple times. Each letter can only use once to make a word. But if you don't know the rules of Boggle, you create your own rule structure, which is what you did. You just said, I can do whatever letters are on the board and do whatever I want. But those of us who will play the game Boggle get confined by the rule structure of Boggle. The same thing happens when we educate and when we try to be creative, is that we get confined by our current experience and our past experiences. And only by thinking about where our constraints lie can we really kind of get outside of our box. And it's a little bit of the opposite of like the original spoon from the Matrix. When they're trying to bend the spoon, what you have to know is the original spoon. It's like if you don't think you have a box around you, you're missing the box. There's a box there. You just have to figure out where the walls are. And then you can break down those walls and you can do some really creative work. So I just like this as a little demonstration of breaking down walls. And that's what we're going to try to do, is break down some creative walls today. We'll just talk briefly in this section a little bit about what everyone has discussed at some level today, about the way that we learn and the way that we process memory. So we take in sensory information, we write it through our working memory. It's that 4 to 6 things that we can process at any given time. If we don't continuously work it out, how do we lose it? And then we try to take that working memory and put it into our long-term memory to actually form things that we can access later on. So only when things get into our long-term memory can we utilize them on a recurring basis. What I think we need to keep in mind is as we're teaching different levels of learners depending on what the knowledge is. So this is what I like to call the dirty room of the novice learner. So this is our medical students, or maybe our interns who are just out of medical school. Or if it's a brand new subject for somebody, this might be the way that they look at this brand new subject. And it's, like, let's use ECMO for example. ECMO came out after my training was done. When I first started learning about ECMO or LVAD, I had no idea. I used some basic physiology, but that was it. So I was really at a novice level when I started learning about ECMO. As we progress and we gain structure, we start to build heuristics and some foundation of knowledge that allows us to organize our toy room into these nice little compartments that And what that allows us to do is reduce the cognitive overhead we use to utilize the information. So instead of, like in this slide, where everything is stashed in different corners and I have to go to all the corners and put things back together again, once I get some expertise in an area, now I can just access the CHF section and you're talking about CHF. And instead of learning everything, I'm learning 2 or 3 things on top of everything I already know. And then as we advance in our careers and we get more experience, these are your upper level residents and your faculty. These are the ones who argue and disagree with you while you're giving your lecture about the fact that there was a paper that came out yesterday that counters what you just said and you should have read that paper by now. So that's the next level is when you can actually utilize the information you've learned to question what you're being taught. So when we're teaching residents in particular, oftentimes we're teaching all these learner levels simultaneously. So we're teaching the medical student who just started clinical all the way up to the professor who may have written a paper about the subject that you're talking about right now. So it's a challenge for us to keep this all in mind. And what I recommend is that as you're building your lectures for a diverse audience, first consider your audience, but then keep tidbits in there for everybody. So you need some tidbits that keep the professor engaged. You need some tidbits for the junior learners. Sometimes it might be taking the more experienced people and getting them to feed back into what you're talking about and helping teach with you as opposed to trying to teach them something. So you just have to keep that in mind as you consider your audience. We'll talk a little bit about System 1 and System 2. This is from thinking fast and slow. So these are our 2 thought processes. And the reason I like to bring it up is that whenever you're teaching, you have to consider System 1 and System 2 with your audience and whether what you're talking about is System 1 or System 2 for them. So System 1 is this, 2 plus 2. Very simple problem, 2 components. One is that you process it instantaneously, and the second is that no matter how much effort you put into solving this problem, you can't solve it faster. You just know 2 plus 2 is 4. You can't put in more effort to solve the problem faster. So this is your advanced learner when you're teaching them about, ATLS information. They've already done ATLS 1,000 times. They understand the components of ATLS. Versus System 2, which is a problem like this. So System 2 is more complex. It will take effort. More likely than not, none of you have chosen to do that effort right now. You're like, I can solve that if I wanted to, but I don't feel like it. And I think Rob mentioned a little bit, like our brains are inherently lazy. We are always defaulting to System 1 whenever we're given the opportunity to default back to System 1. So when you're lecturing, the same things happen. You're expecting this high-level engagement from your audience, but in fact, any chance they have to, they drift away to a System 1 thought process. And that all comes down to cognitive load theory, and these are the main components that are considered in cognitive load theory. So the intrinsic load is the inherent difficulty of the task that you're trying to accomplish. The extraneous load is the difficulty that you put into the task as the educator, and then the germane load is how much effort it takes to learn to solve the problem. So when you have all these 3 components finalized to solve the problem, it fills up their entire brain, they can't do anything else. They're maxed out, all they can do is solve that one problem. But if the intrinsic load is low, the extraneous load is low, and the germane load is low, they have extra work to process other problems. So when you're building your presentations or educating any component, you have to think about those components as you build your structure. And so this is a level of arousal curve, and this is from a study that was originally done dozens and dozens of years ago. But everybody, do we have a laser pointer up here somewhere? It's on my clicker. I'm using a different clicker, so. The clicker is missing. All right, well, so this is a level of arousal curve, and what this basically says, and there's no way to give this talk without it sounding slightly sexual, so I'll apologize for this little guy. So as you get more engaged with a problem, your performance increases. So this is when you are starting a shift at 7 o'clock in the morning, there's one patient signed out to you who's a psych porter, and there's nothing going on. And you're bored, and you get like one patient shows up, and you're like, I have to go see that one patient. So we're down here, we're not engaged, we're not interested. And as our level of arousal starts to increase, so does our performance. So the day starts coming along, you start seeing more and more patients. Now there's like 3 patients waiting to be seen. You've got 4 patients in your queue. And now you're in your high level of efficiency. You've hit your maximal performance. But all of us, at some point, fall off that maximal level of performance. Now you get 2 drive-up DSWs, you have a septic patient that needs a central line, You have somebody that the ICU won't take because they're not sick enough from the DKA. Then you have someone else they won't take because they're too sick for transport to the ICU. All of a sudden, you're over here somewhere, and you're off of your level of arousal. So the same thing happens when you give lectures in the DKA as well. You have to keep your audience within their comfort zone of just enough level of arousal, but not too much. So they're staying organized, and they can keep up with you in the lecture. So again, just another little cognitive theory component to think of. And this feeds into how we design slides. And I think a lot of us have seen lectures where when we see a slide, it's a slide full of words. When you see this sentence, it seems like it's really easy to parse. But in fact, when you see a sentence like this, you're not just parsing out that sentence. Your brain's taking all the different components of that sentence, and it's breaking them down and putting them back together again from the shapes that make up the letters, and the letters that make up the words, and the words that make up the sentence. So it's taking every component and processing it, which is a really challenging thing to do. So when you do words, like when you use words like this, your brain has to be functioning at a much higher cognitive load than if you use images. And so this is actually a brain map that was done, and it shows where various words stay in our brain, where they live in our brain. So you put something in an fMRI scanner, you scan their brain while they're reading sentences. They've mapped out where the words live, and what they found is words don't just live in one component. One word might live in 4 different places in your brain, depending on what way the word is used, because words have multiple meanings in the English language. So when you use a word, your brain first has to think about in what way are you using this word, and not where does it live in the brain, and it retrieves it, and then it reconstructs it after consideration. So that takes a lot of effort and work. Images are much easier. So images live in one place in our brain. They're instantaneously retrievable with minimal effort. And then as Rob mentioned, if you take an image and you put it in an unusual way, it'll spark a very easily recallable point in your brain. So that Mickey Mouse tattoo isn't just a picture of Mickey, it's like this ridiculous picture of Mickey. And that's what you'll remember, is this ridiculous picture of Mickey. So when you're building out your slide decks, think about that. We're going to give people a little jolt as they're going through their slides. So I, like Rob, am an analog person to begin with. So actually, I had to bring this up just for you, Rob. It's not my calendar. I do an electronic calendar, but it's all my ideas start on paper like this. So that's my analog component. And as Rob said, most of us jump right to the computer when you start making a slide deck. Start here. Start brainstorming. But again, just to reinforce it, give yourself time. Because as you construct your story, you have to think about the components that make a meaningful story. And stories aren't just this car chase from start to finish. Stories have art, they have timing, they have components of engagement as a talk should. A talk can't just be me up here talking like this the whole time. But a talk can't be talking like this the whole time either. Your talk has to flow and have ebb to go along with it. It also needs heroes and it needs enemies. And that hero can be the great doctor, the enemy can be the disease, whatever it might be, you need to have that protagonist-antagonist relationship when you tell your story. Once you've constructed your story, give yourself time to mull it about. Your brain creates best when it's not thinking about the thing that you're trying to create. It's when you go for a walk, you come back, you write a little bit in your book, take a shower. Great idea is come in the shower. Why? Because there's nothing else to think about. Your brain gets wander. And there's great evidence that demonstrates that when you allow your brain to wander, you can actually be more creative. Come back, create some ideas. Once you've gone through this iteration, which really for a good talk takes months, or maybe you make a mediocre talk to begin with and grow it into a great talk as you go along. Then it's time to storyboard. So after you've kind of created the story that you think you want to tell, then you storyboard. And I like the post-it note idea. I don't recommend like a standard size post-it note, so like use the slightly bigger ones, like 3 by 5, I think. They see a little more room and they more closely model the slide size that I like to use. So we've got our story, we're done with the analog portion, and we're going to move on to actually creating our slides. And so this, I'm happy to make this interactive. Please ask questions, interrupt. I would love to just answer spend time answering questions if you have as we go through this. So again, this is not what we want with our presentations. So horrible background, stupid transitions, a picture that's not necessary. We want something smooth in this. So we'll go through a few steps on how to create, I think, better slides as you're creating your great presentation. This is always a risky thing to do because invariably people who are speaking before and after me violate when I say the rules for slide design. And so I'm always a little sheepish when I do these slides. So my first review rule for slide design is do 16 by 9 slides. We don't buy 4 by 3 televisions anymore, so why do we still make 4 by 3 slides? We buy big widescreen TVs to match the big widescreen review artwork now. So it's the first step, the easiest step in creating better slides, is 16 by 9 slides. So if you're a PowerPoint person, if you click on the design section up top, you'll see in the right-hand corner, slide size will come up, and then you pick widescreen. So this is one spot where I like PowerPoint does better than Keynote. Once you set this, it stays that way as your default from now on when you make your slides. The downside is that if you take a 4 by 3 presentation Keynote, and you make it widescreen, it stretches all of your images. So you have to go back and fix every single image manually. We did that a couple of years ago with this slideshow. I switched it over to 16 by 9 and all the pictures got screwed up. So I like that it sticks, but I don't like that you can fix all of your slides. So if you're a Keynote person, when you open up Keynote, it'll ask you for a new presentation, and you just click on live there. The downside to Keynote is that Keynote will default back to standard every time you restart it. It just converts everything over to 16 by 9. So images and the various ways that we screw them up are one of my giant pet peeves. So one of the rules I use is what's called respect your borders. Especially if you're a PowerPoint user, you will see that almost every PowerPoint template, which I don't recommend using to start with, has borders on it. You can see them kind of sticking out there. So they have these lines and these borders. These are meant to frame your slides and your lecture. They're meant to keep some open white space on your talks. So when you're using slide backgrounds that have borders, respect the borders and acknowledge that they exist. We'll pretend this middle one doesn't exist right here, but I stay within those borders. So that's one way to treat your borders. Obey them. The other way is ignore them completely and just take over the whole slide. I think personally the best idea is to use slide backgrounds that don't have borders. If you use Keynote, it's almost impossible to find a Keynote background that has borders. Bad backgrounds, big mistake. Along with bad backgrounds and bad colors in your fonts, I think it's really important to remember red green. So significant portion of the American population the male population is red green colorblind. So if you use pure reds and pure greens in your slide, they won't be able to sometimes see them at all or detail the difference between them. So the things that you can do to avoid those colors, or if you're going to use them, use red and greens that have like almost a hatching in them or have like a dark shading to them, because then they can see the dark component of the red green. Or I'd recommend avoiding it completely. And then on this slide, obviously, background that doesn't actually allow you to see the font, and a font that doesn't really look good broadcast against the slide background itself too. So not just the photo, but the bad background itself. And the other thing you'll notice, depending on where you're lecturing, the lighting here is decent. It's not great. It's not terrible. But if I were to do a radiology lecture, I would need all these lights turned down. I would have complete control over how much light gets onto the screen. And if you're using things that make subtle contrast changes, that won't work in a lot of these venues. So you have to create the contrast change in your slides when you make them. Clearly, as Rob pointed out, this is not an acceptable slide. Making science interesting and engaging can be a real challenge, but it's important if you want to get your message across. Because just like you said, we're here to inspire, we're here to educate. If you're boring your audience, you're not doing either. Graphics, along with photos, I think are a huge problem. A, we use them when they're not necessary. B, we use crappy versions. Distortion, one of my big pet peeves. So when you have a picture that's meant to be a certain dimension, keep it that way. The skinny person, you can make back if you switch their photo down and fit it in. That just, it looks terrible, and it's like you don't care about the quality of the product you're putting out. So keep your pictures in proportion. Again, on Keynote, it does it automatically for you, so when you resize the photo, it'll be both dimensions at the same time. On PowerPoint, the default is to allow you to rearrange with your pictures, so you have to hold down, I think it's the control key while you manipulate the picture, and that will lock in the dimensions, so that you can't distort your pictures. So we'll talk a little more about pictures here. So this is a picture of the thinker. A great photo. Looks okay on this slide. I'll show you why this isn't such a great photo in a minute. What's wrong with this photo? I stock photos, yes. Watermark photos just show that you didn't take time to find a decent picture or one that wasn't copyrighted or didn't have some sort of rights restrictions. So especially when you search for higher resolution pictures, you'll come up with more and more images that are watermarked because they're not meant for public use. They're meant for sale. If you're not buying them, they don't want you to have them. One of the ways that you can use photos in kind of an engaging way, and I think this is great when you're visiting lectures, is if you take your audience and add them in somehow, kind of like what Rob did with my picture there. A little thing I like to do is find pictures of faculty and just add them as a little bit of flair onto the end. She missed it. She didn't see it. You're a star of the show. Residents love it when you put the APDs and the PDs into a slideshow like this. It's like, so-and-so said you shouldn't do that. It makes it personalized for the group. So this is my previous picture of the thinker. That looked okay when I was looking at it as a little tiny picture. But when you blow it up to the size you might use in a presentation like this, the picture is incredibly distorted. So that it's really pixelated. It's not a great image. So you want high resolution photos like this. So if you see the difference, and that's the exact same photo, just one's high res and one's low res. So I'm a big Google Images guy. So if you are in Google Images, if you click on Search Tools, and then on the left side you'll see large. So Search Tools on the right. We're losing our battery on our phone. And then large, you'll see on the left-hand side, the large shows up. So we want those large images. That's how it gives you the high resolution photo. So the next thing is putting text over images. So this is a common problem you'll see. You'll put text in that blends too much with the background. So there's a couple of things you can do for this. One is you can gray out your background. So if you're trying to get a text message across, you can gray out your background to do that. The other thing you do is you can just make it a color that's going to stand out from the background. And so even if I were red and green colorblind, I would notice that difference because it contrasts against the background so much. And then finally, you can have drop shadows. So this is a drop shadow. So if you go into your font settings, you can put a drop shadow on that gives an extra, almost like a cartoon outline to your font so that you can see it better. You want your fonts to be clean, simple. Nobody wants to see an entire presentation with Comic Sans. Like you want a nice, clean, simple font. All right, so I'll show you a little tip I like to do to kind of customize images a little bit. Any questions so far? Any points? Anything anybody wants to say? Any PowerPoint people who are like, oh, I know how to do that in PowerPoint? No? No? All right. So I'm going to show a little technique called Instant Alpha. If you have PowerPoint, it's called Remove Background. So I have an image like this that looks good, but when I have this white background on this image, it's very clear that this is a stock photo that I had nothing to do with. So what I do is click on my image, and then I click on Format, this, and then I go to Instant Alpha. And what Instant Alpha allows me to do is it allows me to take the background out of this image. So I just click down, and it'll show me when I'm done with the alpha how much the background will go away. So as I drag out from the center, it gets less refined as to what it selects. Now, if I go crazy, it starts to take out my image itself. But as long as I stay within reasonable confines and there's a consistent, solid background, Instant Alpha will take out that background, and it'll make it look like the slide is something I made, the picture is something I made as opposed to something I just found on the internet. Now, you'll notice if there's not a communication with the color, it won't take out certain spots. So if you notice that, you can just go back in and do Instant Alpha again.
find that little spot, and take that out. And I recommend is when you're doing these little instant alpha changes, you really zoom in to get as close to the detail as you can. Make sure you got all the spots. Make sure there's nothing that you should have found that you didn't. So instant alpha is a great way to take a picture that's not yours and make it look like it's yours. Now the other thing I recommend is when you have photos like this that are cut off. So this one's not terrible because it's just the base that's cut off, but it looks out of place now because I've taken away this frame. So if I have a picture where the base is cut off like this, or even worse, if it's not just the base, but it's like the base and the back. You know, if I've got this kind of a picture, that just doesn't look like it doesn't look artistic. It doesn't look professional. So what I like to do is take these pictures and either put them in a place where they look like they belong. So now it doesn't look like I just found a picture that had parts of it cut off. It looks like it belongs in the corner of this slide. If you don't have a meaningful way to do that, the other thing that you can do then is just put a frame around it. And you put a frame on it by doing style and then border, and we just put a picture frame on. And now it, again, looks like there's a reason for the body to be cut off. And all these little touches are just ways of kind of putting a little bit of extra care into a presentation. So I guess I look at it like if you have a poor quality presentation, poor quality slides, then it demonstrates that you didn't put effort into the rest of your talk. So I think that this is kind of the gloss of the lecture, but I wonder what else you missed if you didn't catch some of these things. So contrast, and this is one that some of the slides here violate, I will admit, but if you are watching a lecture for a long period of time with a bright white screen, it causes eye fatigue, especially if you're in a dark room. It's not so bad in here because we're in a bright room. But if you're in like a movie theater watching a white screen the entire time, you get pretty significant eye fatigue after a while. So I recommend using a darker background, such as the background on the left, and make that your slide background. I really like gradients, because gradients kind of make your image stand out a little better than a straight dark background, especially if you have darker images. But think about reducing eye fatigue, especially again with radiology images. If you put an X-ray against that white background, you're blinding your audience and expect them to read fine gradients and contrast. So then we'll do a little thing on capturing photos, or capturing screenshots. You should learn how to capture screenshots if you're going to make a presentation. It can be very useful, like the little segments I showed where I showed how to do the Google searches and I showed how to do the live streaming. I did those all with image capture. And again, I don't know exactly how you do it on a PC, but on a Mac, it's Control-Shift-Command-4. So you hold Control-Shift-Command down, and then you press 4, and then what you see is this little target comes up. If I hit the space bar, it'll do an entire window. But if I really just want one thing on here, if I only want one object, I can just slide that one object, get what I want, and then paste it in to my presentation. So if you use Control-Command-Shift-4, it'll paste it into your clipboard. If you do Command-Shift-4, it'll paste it to your desktop. Yep.
For PC, it's the snipping tool.
Okay.
You go start, keep and type in snipping, and then it'll show up.
And that comes with the PC. It's like an automatic or installed device. Okay. So learn how to do screen captures because they will come in handy for you when you're building your presentations. All right, video. So video is like everyone's nemesis when it comes to presentations. So this is a video I ripped off the internet before my talk.
It's called password. We have to guess the secret word based on a one-word clue from your partner. We'll play a little version of that. Samantha is everything. Hi. See if you can guess the song.
All right. So when you're in your video, you can manipulate it. So if the part you had you didn't like, you can fast forward it. When you're making your videos, never rely on YouTube as your source for video. The internet will fail, and then your talk will fail if you rely on your video. So I use an app called Video Box. I've been warned by somebody I recommend this to that you have to be very careful about searching for Video Box because apparently there's a porn site that's very close to Video Box. So with Video Box, all you do is, and you're going to get to see how the sausage is made a little bit here, but so with Video Box, you can see where I get all my sources here. You just take an URL and you drop it in. So if I just, sorry, let's just say cat video. All right, so then I will get my cat video.
I'm here.
Once I get my video loaded up, I just go up to the link and I drag and drop the link into the installer, and then it will translate it into a video that I can embed in my presentation.
So that works great for Keynote. It will embed in your presentation. Everywhere you keep your presentation, the video will live in that presentation. The downside is it makes files pretty big. So if you have lots of video, your files will get upwards of a gigabyte for your presentations. The upside is it's always in the right spot. What happens with PowerPoint is PowerPoint creates links back to your video, and so if the drive that your video is assigned to is changed, so if you put it in the thumb drive and plug it into a different computer, it doesn't recognize that link anymore. And that's why you see people's videos break all the time in PowerPoint, because they don't have it embedded. There's a setting to embed videos in PowerPoint that's buried in their settings. So if you're someone who uses PowerPoint and you want to use video, I recommend you search how to embed video in PowerPoint. And that'll keep you from having those little video errors. When you rely on the internet, there's just too many opportunities for things to go wrong. All right, now we'll talk about one of my current biggest pet peeves, I think, with presentations. How many people have seen the presentation that they get thrown in the background? Like, my residents love them right now. This is maybe the world known as this, but like, these things make me insane. Why are GIFs created? What do? They're incredibly distracting, right? Like, you cannot not look at that. You just can't stop looking at this ridiculous video. So this is my public service announcement for GIFs. I'm not against GIFs. I think a GIF is fine. But what I like to do is create a layer over the GIF so that once it's kind of run the cycle a couple of times, I've got my audience's attention, I can stop it. You can see I didn't quite have my frame lined up perfectly, so he's dancing in the background. But the way you do this is, again, I taught you that you have to learn how to use screenshots. So if we go back to my first GIF, I want to get this to be fairly big because I want the resolution to be okay. And I just take a screenshot of this. Capture that, and then this is my video, so then I'm just going to put it over my video. Try to line it up as best you can, and I won't make it perfect because I'm not going to take that much time. So once it's over my video, then I've got to do a build-in with it so that it's not covering my video. So I just want it to be an appear, and I want it to be an appear on a click. So what will happen now is, so right now that's my video, and this is my GIF, and this is my image that's going to go over the top. So now when I start the slideshow, my video plays. When I'm done with the effect of the video, I just advance it, and it goes to the screenshot that it's made. So I get a couple of cycles. The audience is not listening as long as that video is playing. So stop the video and start talking to your audience. All right. So then I want to go over something called Magic Move. There's a similar tool again in PowerPoint, not quite as flexible as Magic Move. But I want to do just a quick demonstration with Magic Move. And I guess my point with a lot of this is to kind of give you some fodder for thought when you go break at lunch and think about ways you might want to incorporate this.
so Magic Move is a pretty powerful tool that simply looks at changes between one slide and the next and then makes the animation happen to create those changes. So what we'll do is just throw some shapes on here. Color. All right, so put some shapes on the screen. Nice if the default is black. Deal with that. All right, so let's just say that this is the last slide that I'm using. This is what I like to call creating visual lists. So the idea is that I'm still using imagery while I build a list. And we can just say that, these are farm animals that cause disease to humans. And when you use Magic Move, you have to think backwards. You have to think, what do I want my last slide to look like? And so the last slide is where I'm going to be talking about the pig. And I'm going to copy this slide and then paste it back in again. So my previous slide, I wasn't talking about the pig. He wasn't there yet. I was talking about my rabbit. So that's enhanced there. Now I'm going to copy this slide and paste it again. And now the rabbit isn't there yet because I haven't talked about him. Now I'm talking about my goat. And then I'm going to take all of these and I'm going to apply what's called Magic Move. And so now when I'm playing this presentation, talking about how to do it, I'm talking about my goat, blah, 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 blah. And I'm done talking about my goat, I'm talking about my rabbit, he's the center of attention and focus. And when I'm done talking about the rabbit, I'm talking about the pig. So I've created this visual list that you can build out. With a widescreen slide, you can do 3 on the side and 1 in the center, and it's still pretty easy to read and pretty legible. You can add little titles to the bottom if you want to. It takes a little longer, but you can do that as well. So that if you get a distracted person that loses track of the talk for a minute, when they come back, they can still see kind of what you've been talking about. So that's Magic Move, and I call them visual lists. And then transitions in general, I think, are an overused thing, but I think can be really powerful. So this is a presentation one of my residents gave a couple of years ago. It was talking about the utilization of CT and its influence on disposition of patients. So we have roughly 100 patients, or 400 patients. Each one of these, if I remember right, represents 10 patients. So these are our 400 patients that before they got a CT scan, emergency physicians thought would be admitted to the hospital. So they then CT'd them and found out that if they CT'd them, they could send almost 100 of them home. So 100 got to go home after a CT scan. They found that if they didn't CT them, of the ones that they thought could go home, it turns out that actually 30 of them should have been admitted to the hospital. So it shows that by CTing patients with abdominal pain, that's what this was, a significant portion could go home, and the ones that you would have sent home otherwise should have been in the hospital. So that's just a great graphical representation of what you can do with some transitions and animation. All right, audience attention is tough to maintain. With this speaker, I probably it's going to be a little quiet, but finding little ways to re-engage your audience can really help.
So what you'll hear is a sentence, a spoken sentence, that's been transformed by a computer to sound like gibberish. So, any idea what it says?
No.
Okay. You can hear it one more time. Okay, now we'll hear the real sentence.
The Constitution Center is at the next stop.
Can they sense that then?
Yeah, wait, was it the same?
It's the exact same sentence you heard the first time.
No way.
It's the exact same.
So there's something about audio and video playing in your presentation and it works that audiences love. It enhances their attention, it enhances their retention. It can be a really powerful addition. You just have to make sure it's meaningful and it works. 2 things that Rob mentioned earlier. And I think with that, I had some stuff about presenting, because I didn't know where our timeline would lie. I think that's probably what I want for the slide design, and it's new. after lunch, I think, and then if people want to have some feedback and input on their slides, I think we're all happy to help. I'll again say I'm happy to give ideas on PowerPoint. I can't tell you how to make it happen, but for keynote people, I'm more than happy to show you keynote and help walk you through it. Even if you're a novice, I'd love to show you the power of the keynote. All right, thanks.